When you're struggling with intimacy, it can cause stress and anxiety, affecting your quality of life. You become preoccupied with the situation, making it hard to stay in the moment and enjoy the experience. Today, we're having our monthly Ask Me Anything, a meme session, where I'll be answering questions from our subscribers and members. If you'd like to become a member and access the full-length episode of the AMA, sign up at Remedies, Subcast.com or Supercast.com. You'll also get early access to all podcast episodes, along with membership-exclusive transcripts. Let's dive into the questions! The first one is about how the strength of an erection is measured, how erectile dysfunction, ED, is determined, and if there's a maximum hardness that women would notice. So, there's something called the erectile hardness score, which is used in studies to evaluate how firm an erection is. It's ranked from 1 to 4, grade 1, not hard enough for penetration. Grade 2, hard enough for intercourse but not fully rigid. Grade 3, firm enough for intercourse and mostly hard. Grade 4, completely rigid and firm for intercourse. This scoring system is a bit vague because it really depends on individual perception. What matters most is whether your erection is firm enough for intercourse. However, many people want it to be as rigid as possible. There hasn't been much research on whether a slight change in hardness is noticeable to partners, but you can always discuss with your doctor if you feel that your erections are becoming less firm. When diagnosing ED, we typically use a questionnaire, it includes about 5 questions regarding your confidence in achieving an erection and how often you can get an erection firm enough for intercourse. Based on the answers, your score will help determine the severity of ED. If your score is high, you likely don't have ED. If it's slightly lower, it indicates mild ED, and it goes from moderate to severe. Ultimately, the key is whether you're happy with your erections and your partner is as well. If not, we should discuss potential causes and treatment options, which could be physical, like blood flow or hormonal issues, or psychological, which we'll address together. Next question: someone is taking SSRIs, selective serotonin reuptake inhibitors, for depression, and is experiencing sexual dysfunction. How do urologists coordinate care with psychiatrists, and what about the sexual side effects of SSRIs? Sexual dysfunction is a complex issue because it's often tied to both physical and psychological factors. If you're stressed about your performance or whether an issue will arise during intimacy, it can prevent you from fully enjoying the experience. This is why it's important to consider psychological aspects as well. I often recommend seeing a sex therapist or psychologist with expertise in sexual health, but I understand that this isn't always an option for everyone. Regarding coordinating care between doctors, if I refer you to another specialist, there should be communication between us, either through notes or phone calls, especially if there are ongoing concerns. But you, as the patient, can be proactive too. Always ask your doctors to communicate with each other. You have access to your medical records, and it's essential to keep them in a secure place so that you can share them with any new doctors you visit. This helps ensure continuity of care and that everyone is on the same page regarding your health. Now, about SSRIs and sexual dysfunction, we know that antidepressants, especially SSRIs, can cause sexual side effects, including low libido, difficulty maintaining an erection, and problems with orgasm. These side effects tend to be dose-dependent. Some people experience them at higher doses but not at lower ones. It's crucial to bring these concerns to your doctor so they can adjust your medication if necessary. There are alternative medications with fewer sexual side effects, so don't hesitate to discuss this with your doctor. Remember, it's important to be open and proactive about any changes you're noticing in your sexual health. Lastly, if you want to hear the rest of today's AMA and submit your own questions for future episodes, join our membership at Remedies, Subcast.com or Supercast.com. You'll also get early access to new podcast episodes and transcripts. Don't forget to share this channel with your friends, and if you haven't already, subscribe or show your support with just one click. And as always, take care of yourself because you're worth it.